This is how you cross over from Israel to Gaza, and right now we're in no man's land. Prime Minister, do you now regret when once asked what your favourite joke was, you replied, Nick Clegg? And Deputy Prime Minister, what do you think of that?
Mr. Trump, why should you be president? What makes you fit for the role? Is it just one big ego trip?
Thank you very much.
People aren't sure they can trust what you say. You say things and then it turns out that they're not quite what you said.
And if we deliver what we say we're going to deliver.
My name's Andy Bell and I've been a journalist for over 30 years. In this podcast series, How Did We Get Here?, I ask a guest to provide context and background to a big story in the news. This week, there is no escaping coronavirus, its resurgence in the UK and what to do about it. I've been talking to Professor Christina Pagel, the Director of the Clinical Operational Research Unit at the University College London. Her expertise, take the maths, take the data to model problems in healthcare and come up with solutions. Christina Pagel, thanks very much for talking to us for this edition of How Did We Get Here? You're somebody who specialises in looking at the data in terms of managing a problem. Bearing in mind that we're recording this early on Monday morning and things could change by the time people are listening to this. Nevertheless, what's the data telling you about the virus right now?
It's telling me that we're back growing quite rapidly. So since September, lots of different bits of data are telling us the same thing, which is that cases and hospitalizations are going up, like doubling every 8 days. And that compares to us doubling every 4 days back in March. So we are increasing a bit more slowly. And that's mainly because there are measures in place, like we're doing social distancing, mask wearing, and people are still working at home. I mean, there are all kinds of things that we've changed our behaviour, but it's still increasing very rapidly. And at that rate of increase, we'll be back at mid-March by the end of the month. I mean,
just going back to mid-March, and before we look at where we were, where we are now, I mean, some of the modelling was criticised and has been criticised since. There was, I think there's now a bit of a consensus that people thought they were behind the curve, in fact, that the virus was taking off faster than some of the modelling at the time was concluding. Is that fair, and should we therefore have any concerns about what we're looking at now?
I don't think it was so much that they didn't get the speed at which it was getting, it was increasing. I think it was more that because they were using at that point the kind of flu scenarios, they underestimated how many people would need hospital. And so the NHS was getting overwhelmed much quicker than they expected because it was a more serious disease than they'd originally thought.
So this time round, we think we've got a pretty accurate handle on exactly what's going on?
Well, I wouldn't say that because the testing system is so strained. But I think we have a much better idea of what proportion of people will need hospital. And we also actually have got better at treating it. So hospital mortality has more than halved since March. So that is a good thing, but people will still need hospital, a lot of people.
Okay, well, we'll come back to that, I hope. But just another sort of question from the layman. You hear a lot of people saying, well, we're finding more cases because we're testing more, because we're getting out there and testing in the community or whatever. That's why we're finding more cases. Is there any truth in that?
A tiny bit of truth. I mean, certainly you can't compare case numbers now to what we officially had in March because we were only testing hospital patients then. So you just can't look at that. And we did increase testing quite a lot between June and August. But since August, from August to September, it was pretty flat, but cases went up, well, they more than doubled. And then since September, as you know, we've had all these issues with testing, and certainly testing has not kept pace with demand, and we're still seeing these massive increases. So I think just saying we're doing more testing is not a reasonable explanation.
Okay, so we have to assume that indeed, the cases are going up. Up to now, is it fair to say the hospitalizations have not been going up in the same sort of way, or is that now changing?
That's changed since September. So that was true for a while, and you can see so Public Health England publishes a weekly surveillance every week, and you can see from that all the way through August it was mainly in the 20 to 29-year-olds, and then also in the 30 to 39-year-olds. But since the last week of August, it started moving up into the older age groups. And since September, hospitalizations have been increasing every 8 days. And that's why when I say we'll be where we were in mid-March by end of the month, that's based on hospital admissions. It's not based on case data because that's not comparable. So we're currently at about 200 admissions a day in England. On the 18th of March, we were just under 400. And by the time we locked down, we were at 1,000. So although we're increasing more slowly, we are heading that way if we keep doubling in hospital admissions.
So we're in the process now where clearly there is a lot of concern at the top of government and a lot of concern at the sort of top of the scientific establishment, if I can put it like that. What do you think it's time to take further action in terms of limiting contact? What do you think?
Yeah, I do think that. I'm not happy about saying it, mind you. You can control and keep this virus under control through really good contact tracing. But we don't have that opportunity now because we can't test and we're not contact tracing. Because for that to work, you have to be able to test people really quickly and you have to find their contacts and ask their contacts to isolate really quickly or within a few days. And we're just not there. And so given the spread that we have now, the only measures we really have left are kind of limiting the mixing of everyone. Because what contact tracing does is it lets you take people who are likely to be infected out of the population for 2 weeks and kind of reduce transmission that way. But because we can't do that, we basically have to stop everyone mixing. And like originally they were trying it just in certain locations, but if you looked at the most recent map of spread, it's now harder to find somewhere that's not a hotspot than it is to find somewhere that's a hotspot. And so we've kind of lost that ability too, because we now aren't testing as much. We don't know where the next hotspots are either. So you kind of are just forced into this situation where national measures is kind of the only blunt instrument you've got left. However, I don't think we need a national lockdown. I think we can be quite targeted in what we try and restrict.
We are told that we are testing now more people than anyone else in Europe. I mean, A, is that right? And B, if we are, why aren't we managing to get some, to couple that up with proper tracing?
I don't know how we compare to testing in Spain and France, but I imagine we're testing more people than most countries in Europe because we have a much bigger population. So I find that a slightly odd thing to say. And also we have more cases. So like Germany and Italy have far fewer cases than us right now. So of course they're testing fewer people. If you test symptomatic people, the point is, are we testing the people we need to test? And we're not. And no one is saying that we are. Like the government admits that, we're not testing the people who need testing. So who cares if we're testing more people in other countries? It's not relevant.
It would only be relevant if you're actually tying it up to some sort of proper tracing apparatus, some tracing system as well.
I mean, testing on its own doesn't do anything. Like, it doesn't cure anyone. There's no benefit to anyone getting a test. It's a public service to try and reduce transmission through isolation and contact tracing. So unless that works, it doesn't matter. Okay,
so we're in a situation where we haven't got a proper test and trace system working at the moment. What would you say then would be a useful measure to bring in now to try and stop the transmission?
What we've learned from the contact tracing that they did do over the summer is that there are kind of two main routes to transmission in the UK, it seems like. One is like pubs and restaurants, people going out and socialising, and the other is people socialising in their own homes. And so I think that's what we have to target. And I mean, unfortunately, it's kind of the things that we really enjoy doing and the things we have to restrict. So I would close indoor pubs and restaurants now, but that has to come with extending furlough for those industries and a lot of support. But basically, we know that indoor is where it's spreading. So I mean, if you can have outdoor beer gardens, fine. Takeaway, fine. Anything outdoors is basically okay. And then also ask people to restrict socializing in their homes. And I don't think the rule of 6 is that useful, because it basically lets you mix with as many different households as you want, as long as they're not 6 people at the same time. But I would say maybe people should bubble with maybe 2 other households, so you can have maybe like a family and 2 sets of grandparents, and just restrict social contact to within that little bubble, and reduce spread that way.
Okay, let's take those one at a time. So for instance, when it comes to places like pubs and restaurants, a 10 o'clock curfew, just not good enough?
Well, I can't quite see how it works. I mean, is it only spreading at between 10 and 11? I just I don't really get it.
I presume the idea is that people get a bit drunker, shall we say, as the evening goes on, a bit more excited, and they forget all idea of social distancing after 10 o'clock. So maybe up until then they can go out, have a good time, spend some money in a pub or a restaurant, and behave properly, I suppose, is the theory.
I mean, I'm sure people are perfectly capable of calibrating when they get drunk if that's what they want to do.
You mean they just start earlier?
Well, you drink faster. I don't know. I mean, it's not that hard. I mean, in the same way that now we calibrate it to 11 p.m. I mean, it's just...
Okay, so curfew is just not going to cut it as far as you're concerned.
Well, I mean, it doesn't seem to be slowing things down in the northwest where they're doing it now. So I'm not quite sure why they think it'll slow it down everywhere else.
Okay. Then in terms of socialise, I mean, the rule of 6 only really came in, it's only been going for a week. Is it too soon to say, is it not just too soon to make a judgment as to whether it's had any impact?
It's more about why would it have an impact if you're just thinking about how it gets transmitted. And the more different sets of people you mix with, the more likely you are to come into contact with someone who has it. Where if you always mix with the same set of people, then as long as none of those people have it, you're pretty safe. And so that's just the principle of bubbling, I think, is better suited to stopping transmission than the principle of you can meet as many people as you like as long as it's not 6 at one time.
So it is about households rather than pure numbers.
Yeah, exactly. So I wouldn't say it has to be a certain number, but I would just restrict it to households. And I mean, it's they're always going to be leaky bubbles. People are at school, but it's about trying to reduce risk where you can in a way that isn't too harsh.
Well, that brings us back to we talk about lockdown, and the phrase is being used, national lockdown is being used a lot. But would you say going back to what we did in March would be the way to go?
No. Because I think we know much more now. Back then, we just didn't know where it was spreading and how it was spreading, and now we know more about it. So for instance, there's no real evidence that it's spreading in shops or hairdressers or things like that. So we don't need to close them. There's no real evidence that it spreads much outside. So I think meeting outside with groups of people is fine. I think we also know now just quite how damaging closing schools were for kids. So we have to do everything we can to try and keep them open. So I don't think we should go back to exactly everything we did in March, because we know more now and we should use that. And also it doesn't have to be as long if we can get contact tracing back up. That what we have to try and do is keep cases low enough that you can still do contact tracing when it's ready. Because obviously if we're at 20, 30,000 a day, then doing contact tracing is really, really challenging.
But if you've got the numbers down, then you can jump on those outbreaks much more effectively if you've got contact tracing.
Yeah, exactly. If you think each person might have between 5 to 10 contacts, so if you have 3,000 people to trace, then that's doable. If you have 30,000, then that's so many people you have to contact, then it becomes really difficult.
What about the argument that it has been very much the sort of 20s and 30s who have been kind of spreading this? And they're the ones who, in theory, don't suffer so badly from this disease? I mean, is this just, rather than the sort of national imposition, is it more a case of people who feel more at risk, the older age groups obviously, people who are vulnerable, kind of shield themselves, as I think a lot of people are doing naturally anyway. You talk to people in their 60s or whatever and they say, oh, well, I'm not going out or I'm not doing this. What about trying to do it that way round and just sort of, rather than some sort of national imposition?
Well, I have quite a few problems with this idea that it's fine if younger people get it. I mean, firstly, they are at much lower risk of hospitalisation and death, but it does happen. It's not like it doesn't happen. And also there are increasing evidence of lots of long-term consequences of COVID in a minority of people, but people who never needed hospitalisation. And that could be heart problems, lung problems, kidney problems, blood clotting problems. And then there's long COVID. And, from the COVID symptom app at King's College, that's, about 10% of people most of whom were previously healthy. So I think we're saying that's quite a big risk to take with a whole generation of people. And secondly, they don't live in bubbles. And we can see now in the last 3 weeks that a lot of infections now spread to older age groups. I mean, who do you think looks after older people? Who serves people in shops? Who are the key workers? I mean, they're our young people. I mean, so I just kind of feel like, how do you do that? And a lot of the people who are vulnerable from COVID are not over 65. They're people with other health conditions in their 40s and 50s. Who are these people's parents? Their bosses. I mean, it's just not feasible to do that kind of containment. And the other thing is that it will completely and totally affect the disadvantaged people the most, people who have no choice about going outside, people who are living in overcrowded housing or multi-generational households are the ones that are going to be affected. If you just kind of let it spread, then the rich are fine, right? The wealth is a really, really good shield because you can afford just to stay in your house. So these are various. I just really dislike that argument. You probably tell that.
I mean, talking of people having to stay in their homes, are you pleased with the idea that the government over the weekend saying people will get £500 if they have to isolate? Basically, that they will get a payment that will allow them hopefully to isolate, because clearly it's been a problem that some people just say, well, I can't afford to stay home, I've got to go out to work. Or what do you think of that announcement?
I mean, definitely. I mean, definitely it's good to provide financial support. I think it still has quite a high bar for you to get that. But I think there was a recent survey that showed that less than 20% of people were actually isolating. And again, having contact tracing if people don't isolate is pointless. I think the £10,000 fine is a really self-defeating thing. Because as I said, there's no upside to anyone getting tested. Like if I got tested, I don't get treatment. It doesn't help me. I either get better or I'll need hospital. That's the case whether I get tested or not. I have to go to the effort of making an appointment and then getting tested, presumably when I feel ill. And now if I get tested and I leave the house for whatever reason, I risk a £10,000 fine. Well, why would I get tested? So you're actually disincentivizing people from doing the thing that you need them to do to control the virus.
Okay, all right. I suppose, again, you can see the theory why, that you want to have some sort of stick. If you've got the carrot of payments for people to stay home, you need a stick to say you've got to obey this.
Yeah, but this government is a lot more sticky than it is carroty. It's not really building this social solidarity, and in fact they've just spent the last 3 weeks blaming everyone else apart from themselves for where we are, which I find quite distasteful.
You mean in terms of we didn't foresee the demand for testing, for instance?
They didn't foresee the demand for testing when the fact that schools go back in September and people get colds it's not exactly a secret. And the fact that they themselves said in April we have to build up really good test and trace system, and then they didn't, and then they had the app which never happened, and yet somehow it's first young people's fault who went out and spent money and did eat out and help out, all that kind of stuff, which the government asked people to do, and went back to work, which the government asked people to do. And then it's their fault. And then now it's our fault. And it's just, I'm just like, at what point do you take some responsibility for where we are? I just find it quite extraordinary.
I suppose the problem for the government is they're not only trying to manage this, this virus in terms of, people's health, they do need to try and keep the economy ticking over as well. So they have to worry about that side of it. Whereas I suppose a lot of other people are approaching it very much from purely the public health angle. Do you think that's fair?
I mean, it's absolutely true that the economy is crucial, and a damaged economy damages health as well. But controlling the virus is the best way to get the economy back. The countries that have had the least drop in their economy are those that have suppressed the virus, and mostly through really good contact tracing. I mean, that's how you do it. And if you can see it around the world, like Uruguay, Taiwan, Vietnam, South Korea, Germany, they're all big countries that have managed to get contact tracing working and have largely opened their economies again.
Is there a case where we just have to change the sort of balance of risk when approaching this virus, and just to say, yes, we're going to have to, and in a sense we're already doing that, because even if we have a lockdown, which we use that phrase, it won't be quite like March. We won't be quite as brutal about it. And is that already evidence that we're saying we're going to have to live with this a bit more and maybe take a bit more of a hit in order to allow some sort of functioning economy? Do you think, does that strike any chords with you?
I think the reason it would be less strict is because we know now what bits matter. So I think it's more evidence-based lockdown this time. In terms of living with it, I just don't quite know what that means, because we still have a population where most people haven't had it, right? 7% of people had antibodies. So maybe that's the population that had it. It might be a bit higher in some places, and there might be something about T cells, but that's definitely still much less than half the population. So there are a lot of people out there who are still susceptible. And in that situation, it's either going to keep spreading, or R is less than 1 and it stops spreading. There is no balance. You can't just keep it where it is. So it's either going to grow or it's not going to grow. And if it keeps growing, at some point the NHS will be overwhelmed unless you're saying, I'm not going to treat these people. So I don't quite see how that is a stable situation that we can live with. I
mean, short of a vaccine, do we have to wait for some sort of collective or herd immunity, whatever you want to call it?
Well, we still have absolutely no evidence that immunity is long-lasting either. I mean, we assume it lasts 6 months so far, but there's no evidence that it lasts longer than that. We just don't know.
Well, you mean you could catch it and it could come back 6 months later, possibly?
Yeah. I mean, there have been a very few cases of reinfection, but at the moment there aren't massive stories of it, so we assume that people are still immune. But there's no particular reason to think it will stay that way for years. But as I said, you can do contact tracing long term and keep it really low, like they've been doing in Vietnam and South Korea, which are similar size to us, of millions of people. I mean, you can do it. It's not that is an unfeasible situation. You can do it. why don't we do it? Because we know how to do it.
Well, why aren't we doing it?
Well, they tried to do it and didn't manage to get a testing system that worked well enough, and a tracing system. But we can learn from other countries and see how they did it and try and implement it.
So who's the best example and how have they done it, contact tracing, where it's really working in your opinion?
I suspect the best example for us is Germany, just because although South Korea's got a better system, it's more intrusive. And I suspect that might not work here. So they kind of actually ask you to leave your house if I had the virus, I would kind of move out and my husband would stay here, and I think that's quite draconian. But in Germany, it's all very decentralized, very local. People get tested basically within a couple of miles of their home, and the contact tracing is all through local people, and you can actually, like they can do things like knock on doors, and then they kind of can do what's called backward tracing in clusters, which I don't think we're doing now, where say you can see someone had an infection and they caught it at a pub. You then go to that pub and you actively try and find everyone who was there and see if they had it, test them. And then you can kind of control big clusters. That's how Japan's done it. For instance, Japan has concentrated its mechanism on trying to stop the super spreading events. And that seems to be working too. And they've had their economy open, for months now. So, I mean, there are lots of different ways of doing it, but I think having a centralized system where basically you can't go into that community and actively work with the population to work out how it's spreading and where just doesn't seem to be working.
And that's what we've been trying.
Yeah, that's what we've been trying.
What about the 2-week circuit break idea? Does that hold any... are you impressed by that, or do you think that's just quite a sort of handy sort of slogan?
Well, I mean, I think it would certainly have an effect. It would work if they did it now. It's just quite a big move to take.
I mean, this is like locking down everything like March for 2 weeks. Possibly not schools, I think. Possibly not schools.
Well, I hope not schools. But I mean, certainly they should definitely be saying to people, work at home if you can. And they should be saying that now, regardless of whether they do a 2-week circuit breaker or not. And they should also be asking universities to do online teaching only, because in America, when they went back a month ago, all the college towns are all seeing spikes.
So a lot of that messaging about get back to work, eat out to help out, let's get some bustle back in our cities. Was that just? Can we look back now and say, oh, that really wasn't what we should have been doing?
It was the wrong thing to do, given that we didn't have a great contact tracing system. And to be fair, I said that at the time. So I'm going to say that now. But I mean, if you looked at, say, from data from America, the Centre for Disease Control there did a kind of a study, and they showed that people who got COVID were twice as likely to have gone to restaurants as people who didn't. So, there is evidence that that kind of thing does spread it. And if you can't stamp down on it, then it will just kind of keep spreading.
If we don't stamp down on it now, I mean, how would you sort of characterise? I mean, it feels as if the government is going to do something in the next few days. I mean, how important is it for you that something is done, and how quickly?
I think something has to be done now. I'd like it to be targeted towards the places where we know it spreads. I mean, what I find really depressing is that looking at the latest Public Health England report, you can see again that the people who are getting it in the most deprived areas disproportionately, that from hospitalizations, the people in ICU are disproportionately from ethnic minorities. It went in the first week of September, there were 30 care homes that had COVID outbreaks. In the second week of September, it was 228. And I just worry that all those vulnerable populations that we learnt were vulnerable in the first wave are being hit again. And I just find that it's not okay for us to just say, oh, well, we'll let them suffer. I guess that's how I see it.
Okay, but I mean, at least we do have better ideas of treatments in terms of how to look after people if they get hospitalised.
Yeah, we do, yeah. And that, by the way, is another reason why I don't think we should just say we live with it. I mean, in the 6 months since March, we've reduced hospital mortality by more than half. And if we waited another 6 months, who knows what we would get then? I feel like it's such a fast-moving area. There's so much research going on into how do you treat COVID patients. And for instance, how do you spot who's at risk from long COVID, for instance? We don't know that at all yet. But if we could only find that out, that would also have a massive impact on people's lives.
But in the meantime, your advice would be act hard and act now?
Act smart and act now. I think there's this kind of idea that we have to close everything, and I don't think that's true. We just have to close pubs and restaurants, work at home, and socialise less at home, and do all the social distancing things that we were doing in March, hand washing, 2 meters, wearing a mask, all of that stuff. And
then we can keep kind of enough of normal life going while actively kind of taking on managing the virus.
Yeah. And then, as soon as test and trace comes back as well, then that will help. And the lower it is, the easier it is to manage. Like, it gets easier and easier the lower it is. So it's kind of a kind of positive feedback loop in that sense. Whereas at the moment we're in a negative feedback loop where the more it grows, the harder it is.
But realistically, we're living with this for 6 months?
I guess. I mean, I'm not a vaccine expert, but everyone's saying they won't be ready until midsummer next year. So I guess, until then.
But we can manage it without having to shut the whole economy down again.
Yes, we can, and we should.
All right. Christina Pagel, thank you very, very much for talking to us for this edition of How Did We Get Here? Let's see where we are in a few weeks' time and maybe talk again. But thank you very much indeed.
Okay, thank you.
Christina Pagel with her advice: act smart and act now. Some of what you heard there may have been overtaken by government decisions, but the overall analysis will certainly still be relevant and important. If you have thoughts on this or ideas for another podcast, email me on andy.bell@itn.co.uk, and please feel free to rate, share and review. I'm tweeting at @AndyBell5News. Thank you for listening to this edition of How Did We Get Here? There'll be another along soon.